Hi everybody, I am that nursing prof and welcome to my channel. In today's video, we're doing another care plan, and this care plan is going to be on a patient who's had a stroke. So if you haven't watched my stroke video, go ahead and check that out, review it, and then come back here and we'll talk about a care plan for that patient. So let's get into our situation. BL is a 76-year-old male who's had a stroke, a CVA, 5 days ago. He presents with left-sided weakness. His vitals are normal. He has a 60-plus year history of smoking. He has hypertension. And then he quit smoking 5 days ago. So the stroke made him quit. That's a good thing. So he hasn't had a cigarette in 5 days since he's been hospitalized for the stroke. In this situation, it's a little special because you're not the hospital nurse, you're the home health nurse. Okay, so we're thinking long-term, we're thinking rehabilitation. How are we going to get this guy recovering from the stroke that he suffered? So our first nursing diagnosis is unilateral neglect. So we notice they're neglecting their one side, the left side. So it's unilateral neglect related to what caused this? Brain injury from cerebral vascular problems, which is a very nice way of saying they had a stroke. And then what's our proof? How do we know that they're having this issue? They are failing to dress and groom the neglected side. So that would be a red flag for us to know, like, hey, there's something going on there, right? So what do we want from this patient? We want them to be able to do that. We want them to be able to dress and groom the affected side by the end of the month. And now remember, we're the home health nurse, so we're going to be checking on this patient regularly, and this type of care is not going to be, in and out in a couple days, a week, or whatever, like the hospital. You're going to know this patient really well, and you're going to see them over several months. So we decided 1 month was a good time frame for this goal to be met. How are we going to make sure we meet this goal? We're going to use the principles of rehabilitation to compensate for unilateral neglect by using assistive devices, feedback, and support. And why do we pick this one? What's our rationale? Studies demonstrate that recovering from unilateral neglect occurs within the first 4 weeks. And remember, where are we? We're on day 5. We're still in that first week. We're in the immediate recovery period, right? So within the first 4 weeks after a stroke, with more gradual recovery after that. Okay, so we really want to focus on getting this down soon. And let's just say, because this is a pretend patient, that we met our goal. We were successful at our goal. So in our evaluation, our goal was met. The patient was able to dress and groom the affected side with the use of assistive devices and help from the nurse in 1 month's time. And that's a pretty big goal. And this is really going to depend on your patient, on your stroke patient. Some will, knock it out in a week and they don't need your help and they're fine. And some will not be able to meet this goal. So this is really individual and patient specific. But this is just a template to teach you how to do a care plan on a stroke patient. Now let's move on to our second diagnosis. Now this one's a little bit special. I think the first one is what we would think of right away when somebody has a stroke, when they're having those obvious symptoms and things. The second one, I want to address the emotional aspect of this, okay? So for this diagnosis, I picked grieving. So grieving related to the loss of health, as evidenced by the patient is crying and expressing feelings of frustration over the loss of functioning. And this is something that's equally as important. Yes, we want them to be, top physical condition, right? Physical things are important, but also emotional things are important too when caring for our patients and making a plan of care for our patients. So we're addressing grieving in this one. So what do we want them to be able to do? The patient will be able to discuss the reality and accept the loss within 6 months' time. So they're never going to be able to get back to 100%, not in this individual patient's case, okay? So they need to accept that emotionally, okay? And we said 6 months. 1 month is not realistic. This is a lot of, mental work, a lot of emotional work for the patient to do, and giving it only 1 month is not enough time. So 6 months is a lot more reasonable. So how are we going to do this? Develop a trusting relationship with the patient and their family by using presence and therapeutic communication techniques. Our rationale for this is the use of presence is a significant part of the nurse's care. So being there, being for, and being with the patient, okay? The use of presence, very, very important. And then of course communicating with them too, having them express their feelings. They need to get comfortable with you, they need to trust you so that they will express those feelings. And that way you can help them work through those feelings. So we'll say they were able to, we met our goal again. So we'll say goal met, patient felt comfortable discussing feelings with the nurse and was able to express acceptance of his new normal. And I put it in quotes because the patient has said, this is my new normal, right? So anytime the patient says something, it goes in quotes. So acceptance of his new normal within that 6-month time frame. And for this one, 6 months is a long time. Maybe the patient took, 4 months to get to this point. You don't have to wait the whole 6 months before you evaluate. You actually should be constantly evaluating your patient. And if they meet their goals sooner, that's great. And you can say that, okay? And then you just change it to new goals after that. That's totally fine. So that was my video on a care plan example for a patient recovering from a stroke. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.